All right, let's talk charting. Charting is intended to provide a medical, legal, and multiple disciplinary function. Okay, it's a record that pertains only relevant patient care information, and that's all it needs to include. It does assist with the planning of the treatment and the care of the patient. All right, so it really is the centerpiece when it comes to allowing others, whether it's the lab or whether it's the respiratory therapist or the units themselves, to know what's going on, particularly when we're talking about the different x-ray procedures and treatments. Okay, the goals of charting are to provide accurate records to the caregivers in order to meet the patient's needs while they're staying in the hospital. Okay, it also too provides a main source of communication for those healthcare providers that are looking after that patient, and as well too, it serves as a record for that patient as far as their condition. Okay, because when we think of the care of the patient, it's constantly changing. It's the condition itself is ongoing. It's fluent, and what the charting does is it provides us with a baseline. It provides us with references. It allows us to determine and to perhaps even to some extent predict the changes that the patient's conditions could possibly occur. Okay, when it comes to documenting, okay, the radiographer needs to keep a couple of things in mind. As a patient enters the x-ray department, okay, we want to make sure that we are kind of eyeballing that patient. We want to determine what the status is of that patient, okay, as they came into the department. So that would be something that we may include on the arrival of the patients as we chart that information. What were they like? Were they somewhat labored in their breathing? Were they lethargic? That sort of thing. Okay, particularly, just a second, I'll let the plane go by. Okay, let's continue on here. So particularly when it comes to what we would consider the most serious patients, so those would be patients that have come from surgical units or ICU and things like that. We also want to be keep an eye on when the patient actually leaves our department. Okay, sometimes the patients may take anywhere from a half hour to even longer to be brought back upstairs into their room there on the different floors of the hospital. So because the porter or the orderly, they wait for elevators, things like that. So we want to make sure that when that patient actually leaves the x-ray department, it is everybody in the x-ray department's responsibility to note what that patient was like as they were discharged from our department. Okay. Now, when it comes to properly doing the documentation of charting, we want to make sure that we do print or write legibly. Okay. We want to use professional terminology and approved abbreviations. Okay, and as you become more familiar, you'll come to appreciate that there's a lot of lingo or a lot of vocabulary and terminology that we use in our own profession, as well as it crosses over into other professions such as nursing and etc. Do not ever leave blank spaces when it comes to charting. Okay, if it's not applicable, then write NA or put a line through that space, okay, when appropriate. When you do enter something into the patient's chart, you must sign your initials as well as what your status is. So you would put an MRT, okay? Keep in mind as well, too, that time is very significant, because if the patient, for instance, arrives into the department and they're stable, okay, they're not having any problems, their vital signs are good, their breathing's good, etc., like this and that, and then all of a sudden there seems to be sort of a turn of events. What we want to do is we want to see how that turn of events, how long it took for that turn of events to occur, and what that sequencing of those turn of events. Like, was the patient complaining about pain, first of all, or were they complaining about feeling nauseated? So when we are charting, we want to be specific about the events and the order, the sequence that those came in. You'll notice in the x-ray departments, in a lot of different areas, there'll actually be still clocks, okay? And that's to allow you to have a quick reference as to what time it is. Okay. We also want to be considering what the patient's response is. So we're making observations. Okay, all right. We're making sure that we are objective in these observations and that they are considered to be relevant as far as what's going on with regards to that patient. Black ink is preferred. Of course, you can never use pencil, okay, because that can be erased. If an error is made, draw a line through the incorrect notation, print correctly above the error, and initial it. Okay, no liquid paper, you can't erase it or anything along those lines. Information can be documented in point form, okay, and again, to use the appropriate terminology and abbreviations. You do not have to write in sentences. As well, too, is that one very important detail is never ever chart for anybody else. Only document the care that you provided and supervised directly. Okay, so we're going to get into the pros and cons of oral reporting. And sometimes what happens is that there are paraphrases or there's misunderstandings that occur. So if you're asked to chart, if you have a nurse that asks you to chart on their behalf, you can simply explain to them, you should be the one that is adding that information. I will add the information that pertains to me, okay, that you have observed firsthand. Never chart or document in a fashion that could be considered a negative assault on the patient's character. Okay, that's actually one of the torts called slander. Okay, so the observations that you make can be descript, but they cannot be in what would be considered an opinionated based manner. Okay, accurate documentation of a patient's condition in the radiology department is essential for professional patient care and legal practices. When it comes to charting, please take your time. Okay, sometimes unfortunately, these situations can be taken into the legal system, and if so, we want to make sure that you have followed the guidelines and the requirements when it comes to charting properly. All right, and that includes when we sort of think of charting, we think of, oh, it's in a binder and this and that. Yes, inpatients have the binder or the chart per se. If you have, though, a patient who's coming through emergency or as an outpatient, the requisition will serve as that documentation for charting. So, for instance, if a patient came in through emergency, they've asked for an exam or a procedure where the patient must stand, and the patient is unable to stand, okay, and now all of a sudden you need to, say, do the x-ray in the wheelchair versus having them stand up. That would be something you would document or chart, per se, on the requisition, and you would provide details. Those are not, you do not have, it's not within your scope of practice to modify exams. You would, of course, have to have a conversation with the ordering physician or with the radiologist, providing your objective observations, okay, such as the patient states they cannot stand because they are in too much pain. There is no pain medication ordered as far as you know, or what have you. So any information that you include on the requisition is really very reflective to say what you would write in a patient's chart. So again, to circle back to what you write on that requisition, it will be scanned. It becomes a permanent record of that patient's chart. So unless you would actually be willing to say that in court, unless you're actually willing to stand up in court and repeat what you have written on there, please keep that in mind as far as when it comes to following the etiquette of charting. Okay, thank you.